Hi, good morning. Healthcare Triangle is a leading digital transformation provider for hospitals and pharma companies. We help hospitals in terms of hosting their electronic health record in a public cloud and also provide data analytics services. Our key investment consideration for this is actually we address a significant market opportunity, about $300 billion healthcare IT, and we continue to innovate and in our platforms which provides a recurring revenues and our revenue alignment to our SaaS platforms, and our margin drivers used to leverage our platforms, and also we upsell and cross sell between healthcare and pharma companies. Our revenue for 2021 was 35 million and with a gross margin of 29%. Our revenue stream comes from three major drivers. We are driving towards into a SaaS platform based recurring revenues. We have three flagship platforms: Cloud Easy, Data Easy and Readable.ai, which I will cover in the next few slides. What we do is we help pharma companies go there, help their clinical trial discovery process in an accelerated way. Because there's a huge amount of data comes from clinical research organization, data coming from a social tools, and also a lot of health systems. This pharma companies takes a time to process those data and provide a insight to the scientist. A typical data pipeline can build about like a 12 months period, whereas we accelerate the entire thing through our Data Easy within a month. So this it saves about close to 60% of their cost and also accelerate their entire time. We also do cloud-based EHR managed services and implementation services for hospital providers. We help regional hospitals to large health systems. We are proud to say that we are one of the partner who has a 3 top premier partnership with the 3 cloud vendors. Our DNA is on cloud, and then we acquired a healthcare domain in the last 7 years to build the healthcare expertise. Amazon has about 80,000 partners and only 80 are top cloud vendors, and we are one among them. Compared to billion-dollar companies, we are one among them. Same thing for Google. We achieved our premier partnership last year, and also Microsoft Gold Partner. We also partner with 2 top electronic health record vendors, Epic and Meditech, which are the leading vendors where we implement and also host their application in the public cloud, which saves a significant amount of cost for the hospitals. We found the healthcare triangle to address a very critical need in the healthcare IT space. There is a huge digital transformation demand where people need to from a hosted infrastructure into the public cloud to save and also accelerate their entire development process. So we use our Cloud Easy as a tool, and on the data is a major problem where people really how to solve the data in terms of PHI data, how do you do analyze and everything. So we use our Data Easy platform, and also we solve the interoperability challenges. When the hospitals merge, each hospital hosts a different EHR system, health record systems, and integrating them is a major challenge for the hospitals. So we have a proprietary technology which allows them to seamlessly integrate. Maybe some customers are using homegrown systems, some customers all scripts, Cerner, Meditech or Epic. We could able to bring all the system and provide the patient care in an effective way. As a patient goes from one hospital chain to another hospital, his medical record, they can able to access it. And this healthcare IT industry is suffering with a huge security and data breach, and that is our core expertise. We automate the entire flow with our security data. In fact, we yesterday announced that we achieved one of the highest level of security compliance called High Trust. Today High Trust, there are only globally about 100 companies who are High Trust certified, and we are one among them. And there's about a $13 billion average data breach cost happening. And also like a COVID-19 is accelerating the hospitals to adapt into cloud technology much faster. Our market positioning, if you look at it, there is a 4 major pillars. There is a cloud, data, and healthcare IT services and security. We bring all the kind of excellence inside to address a $300 billion opportunity, and our specialty is actually in the data and in the security space. Our key competitive advantage, if you really look at it, compare with the other major players, the global SIs, is through our proprietary platforms, which is ahead of our competition by more than a couple of years. And our clinical, operational and financial expertise with the healthcare domain accelerating the entire value chain in this healthcare IT transformation. We are expert in cloud security and IT compliance because the continuous security and continuous compliance is critical for healthcare industry. We are HITRUST certified and HIPAA and GXP, and our ecosystem of partnerships with the top cloud vendors and healthcare vendors provide us access to more number of customers. Our growth strategy to become a top 10 healthcare IT provider in the North America. We intend to achieve this through our partnership, in our innovation in our platform. We continue to do research and development to build the technology, and also upsell and cross-sell our solutions between healthcare organization into pharma companies, into insurance. We are entering into insurance sector also, payers. And we also scale through acquisitions. We have done an acquisition in December 2021. We went IPO in October 2021. And in December, we have made a first acquisition, which is a leading Epic-based EHR implementation and managed services company for large health systems and cancer research society, and expand our solution into the US and global market. Our platform has the capability to support a different compliance need for European Union or US and others. Quickly look at our technology portfolio. Our CloudEasy is our fundamental flagship product, where we provide a multi-cloud platform. So basically any customer who wanted to use, whether it's a Google or Microsoft or Amazon, they can able to manage it, or even they're hosted on-prem cloud. So we could able to manage the both in a way it can able to they can able to manage the data and scale it. It's a very continuous security and continuous compliance is key. We have automated everything through artificial intelligence and machine learning technology. On top of our CloudEasy platform, we built a DataEasy. This is a very key product which we gaining a huge traction. So if you really look at it on the specifically people do a genomic sequencing or population health data or any research, they can able to do all the PHI data removed ingestion, and we can able to provide insights. And we are very proud to say we are now launching a neutral zone where we become a third-party aggregator, data aggregator between pharma companies, hospital organizations, and research universities and algorithm companies. Because none of them share their data, we have the HITRUST certified infrastructure where we can able to host the data, where people can able to access to the data only for the specific research purpose and does not own the data. We feel this is could be a great opportunity for us to scale our business, as this is a pilot project which we are doing between two big pharmas and multiple health organizations and universities, which could scale potentially our business into a larger scale. And our third platform is Readable.ai, which solves a very simple problem, but it's a very complex and expensive for the hospitals. Today the patients still sends by faxes their medical records. We have implemented one of the large hospital, regional hospital chain, Memorial Hospital here in Florida and Atlanta. They get about 200,000 over records comes on by the paper. So they have to put a labor to scan it, OCR it, and then they have to identify it belongs to David and what is social security. Then they have to tag it with their EHR system. It's a very manual process. It could create adversary death rates because of people wrongly tagging, and also it's a very expensive. So we have automated with the Google partnership on a native analytics. We created over several thousand different data model it can able to do, and it saves cost, like average cost is about 80 cents to $1 for a normal processing, and we reduced now to 15 to 20 cents, which is a significant saving for hospital and avoid ADRs, and we provide today up to 95% accuracy on that. When we go to the hospital, our first service is healthcare IT services. We provide from advisory services, what kind of a strategy they should do on electronic health record systems or migration into cloud. From there, we provide a managed services and then hosting on the public cloud. We offer the entire thing, and we save a significant amount of costing. Provide them like a cloud disaster recovery service or a backup recovery, which saves around 30 to 40% on their cost. And our cloud transformation services is a multi-cloud advisory using our proprietary platform CloudEasy, and we bring them into the real time very quickly with our capabilities, and provide truly a multi-cloud, and also link to their hybrid cloud model on their private data center. And we provide a continuous security and continuous compliance, SOC compliance, we provide that. Quickly look at we are about a 35.8 million stock, and our revenue composition consists of three type of revenues: software services revenue, which are one-time revenue, typically a project engagement, which are going like a multi-year contract, but statement of work goes between 1 year to 2 years. The managed services is our recurring revenue, where we provide is a multi-year contracts and a stickiness, and platform revenue is our truly recurring revenue. We launched our platform last year, and we are gaining traction with the multi-year contracts. Our recurring revenue currently around 50% today, grown from 20% couple of years back, and we have a strong visibility on the future contracts, and also we continue to invest in our research and development and sales to accelerate our growth. If you really look at it, our revenue from last year, we grown from $30 to $35 million, and with our acquisition currently we are around about a $55 million run rate. So we are profitable in 2019 and 2020. In 2021 is the year we had incurred a Ebitda loss. This is mainly due to two things. We went IPO in October 2021, IPO related expenses and the G&A, and also we have increased our R&D to make our platforms available in the marketplace. Currently our platforms are available in AWS and Google Marketplace, so people can able to consume in an automated way. Going forward, our research and development will reduce, and we expect to be EBITDA positive in 2022. We have raised $13 million during our IPO, and currently we do not have any debt in books as of today. With the cash and the AR, we have close to about $8 million. So we have a very strong management team currently, and also we have a sales team of about like 12-member direct sales team and 8-member digital marketing team. We have run through territories here, and also we leverage our partnership with cloud vendors and EHR vendors to generate leads. Thank you, and open for any questions. Sorry, I couldn't hear fully properly.
For a facility that wants to acquire the services, can they buy one portion of the service? They don't have to buy the whole package. They can buy CloudEasy or Ebitda?
Yes, it's a good question. So customer has the option to choose any single platforms. Okay, so there are customers they use only CloudEasy platform for the digital transformation. Some customers get DataEasy for their data to be hosted and research. There are some customers who buy all integrated, and Readable.ai is a separate solution for hospitals today for providing the automated content management system. It improves their workflow, data workflow. Whereas a DataEasy, like certain customers use our DataEasy on top of the CloudEasy because it built all the security controls. It becomes easier for them. The biggest challenge like pharma companies face is the research data they consume the huge amount of data, and they can't able to run within their in-house hosted infrastructure, and many of them fail. And also they invest heavily for a case, after they finish the testing, the systems becomes redundant for them. They have a huge cost running in, and somebody has to manage it. By going into the cloud, they save a significant amount of time and effort, and also cost and overall time. And the biggest challenge what these people also have is the security and compliance, because it's not a one time, it's a continuous security and continuous compliance is needed. Yep.
Is your growth coming from internally, from the cross-selling to your existing customers, or is it from adding new customers and the like?
A good question. So we have a both hunters as well as account management, customer success. So we grow both getting a new customers adding and also grow within our customer. To simple example, like a pharma companies, a couple of companies we just like I started with like $2 million revenue. Today even we scale to $8 million revenues in that. So there is a team, we have account management team and the sales hunter team we have today.
I was a little late, I'm sorry, but could you just, I missed your valuation multiples, just, what's your multiple sales, Ebitda multiple, multiple?
Okay, so unfortunately, our valuation is currently running less than 1x our sales. We are running about a $55 million sales, and we are very low price, very attractive for people. We went in IPO in a very difficult time, I would say October, right after that the micro cap got hit, and then the Russia-Ukraine war, so that has bring down the valuation. But as a company we are growing, and we have a potential to grow significantly. So EBITDA multiple we are expecting this year to be around 8%, 8% on 55 million. So it's like, still about less than 6 or 7 multiples.
Your enterprise value now is what?
It's about a $45 million.
45?
Sorry?
45, adding back the cash, you get about 45?
Yeah.
About 10 times. Do you foresee the one-time R&D expenses that were hit last year?
So
Happening again in the near future, this year, or is that just one time?
no, see, last year was a one time because of we made our platforms into be like a marketplace. But we will continue to invest in R&D, but our plan to budget spend about between 7 to 8% of our sales is R&D expensive. Because last year is the little much higher than previous year. If you really look at it, last year we spent close to 15%. It's about 5.25 million we spent. There's 5.25 million spent on $35 million.
So it's going to affect that to like 8 or so percent is normal?
Yeah, 7 to 8% is very normal in this industry.
Are there projections out there that you can share with us?
See, we intend to give the guidance this year. We intend to give the guidance in the next quarters. Any more questions? Thank you.